Hello and welcome to City Beat. I'm your host Greg from the Lewiston City Library. Joining us today is Jessica Jans and Marilyn Keckendorn from SHIBA. Welcome to the show today.
Thank you. Great to be here.
It's a pleasure to have you on the show. So let's kind of jump right into it. So what exactly is SHIBA? What does that stand for?
Yeah, so SHIBA stands for Senior Health Insurance Benefits Advisors. We are part of the Department of Insurance here in Idaho. But however, we're part of a larger network of organizations nationwide known as SHIP programs, which stands for State Health Insurance Programs. Here in Idaho, we happen to call our program SHIBA, though. We have regional offices in Boise, Pocatello, and Coeur d'Alene as well.
There you go. It's kind of top to bottom. Got you covered out there.
Yes.
And then how is this program funded?
So we're funded at the federal level by the Administration for Community Living, and also at the state level by the Department of Insurance.
Very cool. So what specifically does SHIBA do for members of all the communities that they touch, and our community in particular? Yeah,
so we provide free, unbiased Medicare information, counseling, education to all of Idaho. We do that in a variety of ways. We provide one-on-one Medicare counseling for Medicare beneficiaries. So folks that are either new to Medicare, currently on Medicare, about to go on Medicare, we can sit down with them one-on-one and go over their options with Medicare. While we do have our regional offices in Coeur d'Alene, Boise, Pocatello, we have volunteers throughout the state as well, and that includes here in Lewiston. We do also, a large component of what we do is community outreach. We do Medicare 101 presentations, and those are basically about a 2-hour class that we go over all of your Medicare options. It's basically Medicare in a nutshell. It's a very complicated, ever-changing program, so these classes are very important to the public. And we do, we want to get our information out to the public as much as we can. So we distribute literature to outside agencies that might come into contact with Medicare beneficiaries, such as senior centers, hospitals, pharmacies, and so that's the bulk of what we do. A lot of counseling and a lot of community outreach as well. And really what I want to get across is that we are free and unbiased. We don't sell insurance. We aren't able to recommend agents or insurance companies. We simply just provide the information needed to make educated decisions about Medicare. Well,
that sounds like a really fantastic program, being unbiased.
Yeah, we are very busy.
I can imagine. And speaking of being busy, forgive me, we didn't really get into, so what exactly are your roles within SHIBA?
So I'm one of the volunteer services coordinators. I'm based in Coeur d'Alene. Altogether, there are under 10 volunteer coordinators within the state. So in Idaho, there are over 270,000 Medicare beneficiaries alone in our state. So that's a lot of work for just roughly 9 coordinators to handle. So we have our wonderful volunteers, such as Marilyn here, that do a lot of our counseling as well.
Great. And so, Marilyn, that's your role is as a volunteer?
Yes, I counsel people in the Moscow area generally, and help to just give them information about Medicare and all of its parts. The goal really is to kind of get to know them and help solve their puzzle, depending on where they are in Medicare with all the different pieces of Medicare, and then we want to empower them then to know what their options are and to make decisions for themselves.
Well, it sounds like really interesting and very helpful resource, really. So can you describe kind of how that works when you're meeting one-on-one with a client? I don't know what you...
Beneficiary.
A beneficiary,
Mm-hmm.
okay.
Yeah. Well, it just really varies. The most important thing is you meet a lot of nice people. And at the end of a session, you just feel like you have taken something away from it yourself, as well as hopefully given them something. When they come in, you just see what their questions are and try to understand where they are in their lives in terms of Medicare. And then we use the information that we have available to help them piece out the various parts. There's Medicare A and B, there's Medigap policies, there's Medicare Advantage plans, and that gets pretty complex for people. And many of them have similar titles and names to them, and so we just help to distinguish one from another and help them sort through everything so that they can understand it for themselves.
Oh, absolutely. And I know just listening to you for a couple minutes, I have no idea. And I'm glad I don't need to go through that yet. And if I did, I would definitely come talk to you folks and get as much help as I could. Going back to that, I know I'm not quite there yet, but who does qualify for Medicare?
Medicare is insurance for people that are 65 years or older, and so you need to start being interested in what Medicare is as you're nearing that 65th birthday. It also can apply to people with certain disabilities and people with end-stage renal disease.
Wow, very, very interesting. So you're getting ready for Medicare. How does like average Joe off the street or myself on my 65th birthday, I'm wandering the streets, how do I get in contact with SHIBA offices or those resources? How do I tap into that?
Yeah, so the best way to schedule an appointment with one of our counselors would be calling our 1-800 number, and that number is 1-800-247-4422, and that would get you in touch with someone such as myself. It's our call center that's open Monday through Friday, 8:30 to 4:30 Mountain Time. So, and like I said, we have counselors throughout the state. So by calling that number, you can schedule an appointment close to where you live. Also going to our website, which is www.doi.idaho.gov, to learn more about the SHIBA program as well. Our hope is that people reach out to us. We can answer questions over the phone, or if a counseling appointment is necessary, we can do that, of course, as well.
That sounds great. And you mentioned earlier, just kind of how big this this pool is, 270,000 people benefiting from Medicare every year in the state with just a handful of coordinators. So you must rely heavily on volunteers, it sounds like. How does someone get involved with the volunteering process?
Well, what I did is I looked online, and you can go to the DOI website, or you can just Google SHIBA, SHIBA, and the website comes up easily. And then you look for the link that says SHIBA Volunteers, and there is a place there where it says I'm interested in volunteering, and the application is online. Once you fill in the application, one of the coordinators will contact you and answer questions. One of the nice things is that it is tailored to your speed of learning, and so I was kind of scared spitless, to be honest, when I signed up. And then you meet so many nice people that are just there to help you all the time. They're a wonderful resource, and so if people think that they might be interested in volunteering, they definitely should go online and sign up and know that they will get an orientation fully before they're put out there with beneficiaries to give information.
Oh, that sounds good. And we kind of touched on this. You're out of the Coeur d'Alene office, regional office, and you kind of do a lot of your counseling in the Moscow area.
Yes.
So what kind of resources and volunteers are necessary here in the Lewis-Clark Valley, here in Lewiston specifically?
Yeah, so we have a handful of volunteers, such as Marilyn, in the area. In Lewiston specifically, we have volunteers that counsel out of the Washington, Idaho Volunteer Center. So that we still encourage people to schedule an appointment here in Lewiston. You would still want to call the 1-800 number. But yeah, we do need more volunteers in Lewiston and Moscow both. So if anyone watching is interested, please contact us at our 1-800 or go on our website.
That sounds great. And is there anything else you'd like to add today about SHIBA, what's coming up? You know,
Yeah.
Is there any relation between, say, the SHIBA and tax season, say, or is this just kind of a year-round?
We're busy year-round. We really are. And you know, I touched briefly on our Medicare presentations that we do throughout the state, but we do have some presentations coming up in Lewiston and Moscow both. Lewiston, it's mid-March, both of those are mid-March, the 17th and the 18th. So if anyone is interested in attending a Medicare 101 here in the area, we do have that coming up in March.
And where will that be located?
We are doing, our Moscow one is the 17th of March, and that will be at the Clark Place Assisted Living. That's open to the public. And also, so the 18th is here in Lewiston, and that will be at Panhandle Health. So we like people to register for those classes, and you can do that by calling our 1-800-247-4422 number as well.
Excellent. And can you do that through the website as well? Or
you would want to call to register for those.
And confirm, make sure you get someone there.
And those will be about 2 hours, and like I said before, just Medicare in a nutshell.
And is it something, and this is kind of from my own personal perspective, is this something that would be interesting, say someone my age wanting to help, say my grandparents or my parents, is it beneficial for young people as well to just kind of get that idea and take that information back to, say, someone who maybe is hesitant to go, not quite sure, or is unable to attend?
Do you know, I got involved with this because I went to a Medicare 101 class thinking that, well, I was pretty soon going to need to know this information for myself. And honestly, if I had not gone to the Medicare 101 class, I would have not done the right things when I turned 65. And so it is interesting for learning and to helping grandparents or yourself to know what's upcoming and how you can best have information in place for knowing what you want to do when either your parents or grandparents get older, or when you come upon that magic, wonderful 65-year-old age.
Yeah.
Well, that sounds fantastic. And thank you both so much for being on the show.
Oh, yeah.
It's been a pleasure having you both.
Of course.
Hopefully we'll get you back on here again soon with some more updates as time goes on. And on behalf of Jessica and Marilyn and myself and everyone else here at City Beat, we hope you have a great day, and we'll see you next time.